Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, and with Darren Rizzi, our Fire Chief and Director of Emergency Management. Before I give my COVID update, I want to take a moment and thank the provincial government for announcing more than $30 million in additional Safe Restart funding to support our MyWay transit system, which has been badly impacted by COVID-19 pandemic. We have seen a huge decline in ridership on MyWay, still with 60% down from pre-pandemic levels, which has meant a drastic drop in our revenue as a result here at the city. This funding is critical to our ability to continue operating transit efficiently and effectively, and in a way that residents have come to expect, at the service levels that residents have come to expect. We're very fortunate to have partners at both the federal and the provincial level that understand the huge impacts that the pandemic has had on municipalities like Mississauga. And again, I'd like to thank them for their financial support. This past Monday, our hospital partners began to vaccinate people 80 and over in our community. This is incredibly exciting news. Trillium Health Partners has seen thousands of people pre-registered online and have been so busy over the past few days getting vaccines into people's arms. I'd like to personally thank my friend, Trillium Health Partners CEO, Michelle DeManuel, and her entire team. They worked tirelessly and so effectively for getting this set up so quickly. We knew that we had enough to start vaccinating those in the general population, and we simply couldn't wait for the province to get their system up and running. So Michelle and her team did so. Time is of the essence here, and we are in a race between the new variants of concern and getting vaccines in people's arms. I encourage everyone who is 80 years old or older, or if you have a loved one that is over 80, to ask them to please pre-register for a vaccination. The simplest way of doing so is going to their website at trilliumhealthpartners.ca. It will guide you to the link where you can sign in. The instructions are very simple and right on their website. Once you fill in the online form, someone from Trillium COVID-19 Partners will, and their vaccine scheduling team will reach out to you to book an appointment. Within the next week, Trillium Health Partners is hoping to launch an online and telephone booking system where you can schedule an appointment yourself. I want to thank everyone once again at Trillium Health Partners, and of course also at William Osler Hospital, they're our partners up in Brampton as well, for getting their online pre-registration up and running so quickly. The provincial government is launching their COVAX online portal on March 15th, and this will allow all residents to book online through a centralized provincial portal. We have been assured by General Hillier that Peel Region will be receiving more vaccine soon. In Mississauga, we are ready to administer the thousands of doses a day once we get our supply. Earlier in the week, I visited a new mass vaccination site at UTM, that's the University of Toronto's Mississauga campus, a partnership between the university and Trillium Health Partners Hospital. Peel Public Health Clinic at 7120 Huron, Ontario is also now operational, and another mass vaccination centre at Paramount Fine Foods Sportsplex is ready to go too. And we're just days away from being fully operational also at the International Centre. The sooner the federal and the provincial governments can get vaccines here, the sooner we can begin getting through our priority groups and people over 80 and begin moving on to the other groups in the community. We also need the province to ensure their online booking system is up and running for March 15th. This will be how the vast majority of people will book their vaccine appointment. I also urge the province to increase its communication with residents. We are hearing from our residents that they need more direct information, not just snippets in the media, about the availability of vaccinations and when they can expect to receive their vaccine and how to register. I will continue to update on any news we receive here from the province or Peel Public Health on the continued rollout of the vaccine. Next Thursday, March 11th, we will be holding a virtual town hall for all our residents in Mississauga, where we will provide an update on vaccinations and take questions from residents. Please visit mississauga.ca for more information on how you can take part in that town hall meeting. I once again encourage everyone 80 years of age and older to please pre-register for the vaccination. The vaccine will protect you and your loved ones, and the safe reopening of the GTA for the long term ultimately relies on getting as many people vaccinated as possible. For the first time since mid-January, COVID cases in Peel Region and in Mississauga increased this past week. Based on new data we received last night, Peel Region is averaging 95 cases per 100,000, and that's up from 88 last week. Mississauga is averaging 74 cases per 100,000, and that's up from 73 last week, up 1. The good news is that our hospitals are still holding their own. Trillium is currently dealing with 48 COVID hospitalizations, 11 patients in the ICU, and 86 suspected cases. Brampton's William Osler currently has 33 COVID hospitalizations, 6 in the ICU, and 32 suspected cases. In Peel, there are 7 long-term care homes, 5 retirement homes, and 8 group homes and assisted living facilities, which are in active outbreak. Over the past week, I have been advocating for Mississauga to move into the red zone. And that, of course, is within the province's COVID-19 color-coded framework. And I was extremely optimistic that the downward trend we had been seeing in our numbers over the past 7 weeks would continue. After looking at the new data in yesterday's epidemiology report from Peel Public Health, I understand now why Dr. Lowe is not asking the province to move us into the red zone. What's more troubling than our case counts is that our effective reproductive rate is now over 1 this past week. That means for every person who contracts COVID-19, we'll spread it to at least 1 more person, threatening, of course, exponential growth of the new variants and case numbers. I'm really hoping this week's case numbers are just an anomaly. I understand Dr. Lowe will be recommending that Peel move into the grey zone. Along with Toronto, this will give us the opportunity to see how the numbers play out over the coming weeks, allowing us to balance the need to protect the community while also giving some hope to our businesses. Entering the grey zone will allow retailers to open to in-person shopping with a 25% capacity. You can tell that I am extremely disappointed that this is the recommendation, not that Mississauga and not that Peel will enter the red zone on March 9th. I know how hard this news is for our small businesses to bear. If the provincial decision is to move Peel into the grey lockdown zone, we will be asking Dr. Lowe to review the indices each and every week in the hope that we can progress to the red zone and beyond very soon. Our small businesses have had to pay an incredible price during this pandemic, and we've always known that they were not the main source of the transmission of the virus. So many of our business owners, they're our friends, they're our neighbors, and they are our family members, and they may never be able to recover. It's extremely unfair that businesses in neighboring regions have been allowed to open more fully. Think about this for just a moment, if you will. If you're standing on Dundas Street at Winston Churchill, restaurants and stores on the south side of the street are open for in-person shopping and dining, that's because they are in Oakville, while on the north side of the street, they are closed because the north side of the street is in Mississauga. That is simply unfair and also inequitable. And we know that Mississauga residents are going into Oakville and to Burlington to shop and to dine, while our businesses continue to hemorrhage. This is incredibly frustrating for me and my council members, and of course, for our small businesses. We will, however, continue to heed the advice of Dr. Lowe and follow the advice of science to protect the health and well-being of all Mississaugans. Moving into the gray zone may very well give us the best chance at keeping the variants at bay and give us a little bit extra time to vaccinate more people in our community. I'm now strongly advocating that the province to allocate vaccine supplies to Peel and to Mississauga based on an ethical basis, defined by those who are most at risk. As of now, vaccines are being allocated based on population numbers. This is an unfair approach and goes against the advice given by the provincial government by its own COVID-19 Special Advisory Table. The province of Ontario needs to prioritize the hot zones, including Peel, Mississauga, and Toronto. Along with Toronto, Peel has been in lockdown longer than any other region in Ontario, 15 straight weeks now. Supplying Peel and Mississauga with vaccines proportional to our needs is the right thing to do. It's the best way that the province can support our businesses and our community right now. I'm optimistic that our cases will again begin to decline, and we will continue to move forward in the province's color-coded framework. And now, I would like to ask Dr. Loh to please come to the podium to give his update.
Thank you, Madam Mayor, and good afternoon. Mississauga's test positivity for COVID-19 currently sits at 4.8%, which is up from 4.5% last week, and the weekly incidence rate is at 74.2 cases per 100,000, which is up from 73.6 per 100,000 last week. This week marks two significant milestones in our ongoing battle against COVID-19. A year ago Friday, we saw the first detected case of COVID-19 in the region of Peel. And it's fortunate that this Monday, we saw the launch of our extra-large mass vaccination clinics at the University of Toronto at Mississauga and the Save Max Sports Centre in Brampton, with more on the way that have been launched throughout the course of this week. Together with our hospital partners, we have also begun registration for vaccinations for residents over 80 years or older. And while it is a limited rollout at this point in time, limited by supply, it is one small step towards a wider rollout as supply improves. I want to thank our hospital partners, notably Trillium here in Mississauga, for your incredible partnership in making this happen. And for all of our residents, I want you to know, I know that many of you are eager to get vaccinated, and I assure you, please, if you meet the eligibility criteria, continue to register as you can and try again if you aren't initially successful. More appointments will come with more supply, and we are working to vaccinate our community as quickly as possible, and I thank you for your patience and eagerness to get the vaccine when it is your turn. I know it has been long, and we all want to get back to normal, and I'm grateful for Mayor Crombie's commitment and the commitment of all of our councillors and mayors to their residents and the hopes that she shared. It is that shared commitment to our residents that drives me to provide my advice to move cautiously. I know that chasing normal too quickly could mean losing the progress that we've made to this point. Indeed, the last 5 weeks did see favorable trends in our case counts and hospitalizations, but unfortunately, that decline has started to reverse, even within the strict measures in place driven by variants of concern that increasingly circulate in our community. This concerns me. In particular, I don't want to have to reopen only to have the province pull the emergency brake like they did in Simcoe, Muskoka or Thunder Bay. Businesses there in those communities that had just opened and ordered supplies were forced back into shutdown 2 weeks later. An emergency brake, a third wave, would devastate our small businesses. And that is why the recent upward trend across the region and in all 3 of our municipalities calls us to move cautiously. We currently have 100 confirmed variants of concern, up from 5 2 weeks ago, and we have 600 test positives that have screened positive for a variant of concern. We cannot let these variants infect more residents before we have a chance to vaccinate our most vulnerable and then enough of our community to stop transmission and end this. So it's for this reason that over the next 2 weeks, I have recommended to the CMOH that we move into gray lockdown. This allows us to gradually reopen, to move slowly, and to prevent the variants from spinning out of control. This will allow us to continue to save lives, to keep kids in school, and to give our businesses the certainty they need that when they reopen, they will stay open. I know this is frustrating to continue to wait, but I want you to know that I'm also asking that any and all support be given to our impacted businesses in recognition of the sacrifice that you have made to keep our community and indeed all of Ontario safe. The past 12 months since the start of the first case that was identified here has been difficult. But as vaccine supply continues to arrive and appointments continue to fill up, I am reminded that we are truly getting closer to the end. But we must remember that vaccines do us no good if they aren't in arms yet. So we must stay the course for now. Patience remains our best approach, and what we do in the next few weeks could make a difference between an exit from this pandemic in our community with confidence and a third wave more of agony. So please continue to limit your contacts, stay home, and only go out for essential reasons, no matter what precautions and measures are in place. We've made great progress so far as a community, and we are getting closer, but our collective effort is not done quite yet. Thank you, and I'll pass it back to Mayor Crombie.
Before I take questions from the media, I just want to quickly let you know about an exciting International Women's Day that I'm hosting this Monday on March 8th. It's going to be a lot of fun. Joining me for a one-on-one conversation will be the former mayor and legend Hazel McCallion. And I invite everyone to join us for an hour as I chat with Hazel about her incredible career, turning 100, and what International Women's Day means to her. You can find the link to the event on my social media. This International Women's Day is particularly important in the context of the pandemic. Women, of course, have been disproportionately affected by COVID. We know women make up the vast majority of PSWs working in our long-term care homes, the majority of nurses on the front lines in our hospitals, and of course, as children move to online learning, we know that women were the ones who were predominantly juggling children while also balancing careers and other responsibilities. Women are the true rocks in our society, I may say so myself, and I want to thank all of those women who have stepped up big time during this pandemic. And now, happy to take questions from the media. There might be a glitch. Is there a delay? We're ready to take questions from the media.
Our first question is from Steve Cornwell with Mississauga News. Go ahead, Steve.
Welcome. Mayor Crombie, how are you?
I'm well, Steve. How about you?
I'm okay. Just a question on some of the happenings at council today. There was some pretty, let's say, terse kind of language thrown around about Dr. Lowe, kind of, at least the recommendations he made, and that kind of at this point in the pandemic. I think maybe it's something he could address as well. But I'm just, he'd mentioned that some folks are not listening to him at this point. I'm just curious, what would be what would be your message to maybe your council and for residents in Mississauga that are kind of maybe frustrated but are recognizing, as you said, that the numbers are still not looking great at this point.
Let me say that we have complete confidence in Dr. Lowe. We have taken his advice throughout this pandemic and will continue to do so, notwithstanding, of course, naturally, we're all a little frustrated and we're all a little disappointed. 15 weeks in lockdown seems like an eternity for everyone, and there are, of course, businesses which will not recover. And I think perhaps there was presumptive expectation set that we were so close to red, and if things continue to decline, we would be opening our doors on Monday, and I think everyone regrets that that is not going to be the case. However, that said, I know Dr. Lowe will be recommending to the provincial table that we move into gray lockdown zone, as will Public Officer of Health Eileen de Villa in Toronto, but you never know, maybe they'll change their minds at the province, although I doubt it. So we're waiting to hear what the announcement will be on Friday. I think we're all just a little bit frustrated and all a little bit disappointed, not directly at Dr. Lowe, who we always have confidence in, and we take his advice. It's just that the numbers did not align, and unfortunately for us, and I'm very hopeful that perhaps the numbers are an anomaly and will right themselves next week, and maybe we'll have a shot at the red zone the following week. But you can certainly see with any community with an R factor over 1, certainly there is no hope of declining numbers with an R factor of 1. It has to be under 1. We were 9.96. Where's my R factor? Yeah, 0.94 last week. And ideally, I know the province would like to see 0.75 before we go through the color-coded framework. So it's not Dr. Lowe, it was just us expressing our frustration at the numbers. Dr. Lowe, I know he knows that. It's just all very disappointing.
Follow-up question?
I missed the first part of your response. I apologize if you did address this, but are you concerned at all with some of the comments that were made? It may
the comments directed were not, Stephen. The comments were not meant to be personal. We all share the utmost admiration, respect, and confidence in Dr. Lowe. I think my counsel was venting and expressing their frustrations that the case numbers, were not going in the direction that we had hoped. But we all jointly respect, admire Dr. Lowe. We have confidence in him, and we always heed his advice. And that's why I'm standing here saying I support his decision. Notwithstanding, I was very hopeful we were going to go into red, and said so maybe too broadly.
Next question is from Isaac Callan with The Pointer.
Welcome, Isaac.
Hey, Mayor Crombie, I'm having some technical difficulties. Can you hear me?
Yes, we can.
Fantastic. My first question is about paid sick days, and it's sort of in two parts. The first is political and it's for you, and the second is more technical and it's for Dr. Lowe.
Sure.
On Monday, the NDP had a bill on paid sick days voted down at Queen's Park.
It's very disappointing.
5 of Mississauga's MPPs voted against that bill to offer paid sick days. So for you, Mayor Crombie, I'd like to know if you think that Mississauga's MPPs have let their residents down with that vote. And for you, Dr. Lowe, I'd like you to articulate why you're advocating for paid sick days, and if you think the federal benefit is sufficient on its own without additional provincial regulations.
So I'll just share with you, I know Dr. Lowe, and he's going to speak for himself, is extremely supportive of paid sick days. He's the one who pointed out the example in Germany, how they were able to get through the pandemic and cut their case rates significantly because people had paid sick leave and were able to safely stay home with the knowledge that they didn't have to sacrifice their paycheck, that they would be being paid, and they would have the ability to put food on the table for their families while they were safely quarantining. So I'm very disappointed in our Mississauga provincial members of parliament. They know how important sick days are. This should not come down to ideological differences. We need to do what is the right thing. And what is the right thing is that workers, when they are waiting for the results of a COVID test or are symptomatic, stay home with the knowledge that they will be paid. And that is the only way we're going to drive down our case counts and our case numbers. Research that Dr. Lowe has done showed that 1 in 4 people were going to work symptomatic, and 80 of those 2,000 people had a positive COVID test, for goodness sake. So what more evidence do you need that people continue to go to work symptomatic? Why are they doing that? Because they can't afford to sacrifice their paycheck. The only way we can get through this is if we have guaranteed sick leave through 10 paid sick days. The best way to do that is to backstop those companies from Ottawa so that the payment to each individual is seamless and they continue to receive a paycheck while they're waiting for a test result or safely at home quarantining. And I'll allow Dr. Lowe to come and share the same thing with you. I know we're completely aligned on this one.
Yes, thanks, Isaac, for the question. Thank you, Madam Mayor. I think Madam Mayor has said it very clearly. Our own case data showed that 1 in 4 individuals who subsequently tested positive for COVID had actually attended work while symptomatic. And certainly that individuals had actually gone to work having tested positive. And I want to be very clear. These people probably don't want to have to do this, but by virtue of the challenge, even in accessing testing or accessing isolation housing, the inability to be off work, especially for our temporary and contract workers, presents significant challenges to them assisting and really sticking to the self-isolation and stay-at-home procedures that we know help to reduce spread. And so, to the extent that I think this has been a subject that's been well studied, the Decent Work and Health Network have a very useful evidence brief which reviews a number of studies. The one that sticks out in my mind is that a study of New York State nursing homes showed that the nursing homes that had higher rates of gastrointestinal and respiratory outbreaks were the ones that didn't have paid sick leaves because of the introductions on the part of workers. So, I mean, it's people carrying things into long-term care in nursing homes, it's workers into essential workplaces, it's temporary workers who may be contract in different settings, seeding different outbreaks in different workplaces. I would say paid sick leave is really one of those things that is just really, it's kind of, the whole COVID-19 thing is a jigsaw puzzle, but this is one really big piece that continues to be missing in my estimation. Thanks for the question.
Follow-up question?
Yes, I want to pick up on Steve's question as well. And I know you said in your answer to Mayor Crombie that the comments, were not about Dr. Lowe, but I think we should look at some of the statements that were made. One councillor suggesting that angry resident calls could be directed to Dr. Lowe's home phone, describing him as, quote, a messenger, talking about the public not wanting to believe what he said.
Isaac,
just really matter.
No, I think there was a lot of hyperbole. I think that councillors are extremely frustrated. Let's not forget we're 15 weeks into the lockdown. Our residents are frustrated. Our businesses are frustrated. Dr. Lowe is only trying to do the right thing. It'd be nice if our MPPs did the right thing and push forward on sick days and paid sick leave. We have utmost confidence in Dr. Lowe and the utmost respect and admiration for him. We're just very, very frustrated. The numbers aren't going in the direction that we wanted them to, and that we're still in lockdown.
I appreciate that statement. Do you think that a statement from your council as a whole to that effect would be powerful in terms of recognising where Mississauga is in the numbers and how it needs to move forward together?
I'm sorry, I didn't understand your question, but I think we are unified. I think we're all just a little bit frustrated. Of course, we all wanted to be in the red zone. We're learning that we're going to be in the gray zone, as is Toronto. Hopefully, it's only for a week. Hopefully, the new increase in the R factor, which is the one that I'm completely concerned about, is an anomaly and will right itself next week. And by the way, if you've seen today's numbers, we have only 36 cases, so I'm very excited about that.
The next question is from Ashley Newport with Mississauga News. Go ahead, Ashley.
Hi, Mayor Crombie.
Good morning, good afternoon, Ashley.
Good afternoon. I wanted to also mention council. You said something really interesting at council today about lockdowns becoming normalized and how, you've mentioned a few times this has been going on for 15 weeks now, which is a really long time. And you said something that I think a lot of people can relate to, that a lot of businesses and people in Peel and Toronto feel like they're being, penalized or punished for something that is, now in a lot of cases, completely beyond their control. So I'm wondering how worried you are, because you also asked, how long will this go on for? How many people need to be vaccinated before we start to see a broader reopening? So I just kind of wanted to know if you wanted to expand on that and, maybe talk about how concerned you are maybe about the goalposts being moved. Are you worried that, perhaps as the warmer weather comes and more people get vaccinated, are you worried that the province and public health are going to continue to take a really cautious approach and kind of keep things closed until there's more, broader vaccination rollout, which could be at this point, as far as we know, in September? If that happens, would you kind of keep pushing it to reopen as much as possible under the circumstances, kind of working, with the virus and the numbers that, we're seeing?
So you're breaking up a little bit, Ashley, but I do repeat that I'm a little bit concerned that lockdown has now been normalized and that we need to see our way out of it. And now that the weather is improving and the vaccines are here, there'll be more people will be outside, we'll have more people vaccinated, and I'm looking forward to the safe reopening of our economy. I want to get people outside, I want to get people back to work, the kids are back at school, there's nothing else that anybody wants differently. We all want the same thing, just to get back to a new normal. And you know, it may be that having to deal with COVID over the next year or two as some sort of acute illness will be our future and how we manage that. But I'm strongly advocating for the fact that we cannot normalize lockdown. We cannot stay in perpetual state of lockdown. We have to find other methods, and clearly that'll be vaccinations and getting people outside more. But I do look forward to the next week or two when we can safely reopen our stores, our restaurants, our gyms, etc.
Follow-up question?
Thank you. And my next question is for Dr. Lowe.
Perfect.
Thanks, Ashley. Go ahead.
So my question is about the AstraZeneca vaccine. I know today the province announced that it should be used for people between the ages of 60 and 64. I'm wondering, since public health units can have some control over their own rollout, especially with workplace outbreaks and PL being such a huge issue, is it possible, would public health be able to maybe use the AstraZeneca vaccine and offer it to these essential workers? Is that an option or something you could even consider doing, or do you have to follow the province's recommendations in terms of age?
So thanks very much for the question, Ashley. The province sets prioritization groups according to the phase of the rollout that we are in, and then we as the local public health unit have flexibility to work within those prioritization groups, but we do not have the flexibility to add prioritization groups that have not been unlocked by the province. I will note that essential workers are listed in the provincial framework as being tentatively anticipated for a phase 2 rollout, which is around the same time that some of the other age brackets are being considered. And I do know that the vaccine spec around AstraZeneca suggests that it may be used, certainly in populations under 65. So to the extent that I imagine continued discussions are occurring at the provincial prioritization table, and to the degree that we participate in them, we certainly will continue to raise the possibility of using it in essential workers, but we'll have to abide by whatever provincial prioritization guidelines are set. Thanks very much.
Follow up?
Our final question today is from Khaled Salama from My Second Home TV. Go ahead, Khaled.
Mayor Crombie, how are you? I see there are lots of tensions going on. I don't like to tap on certain matters in order not to put more fuel on a fire, but let me tap on something else. There's a lot going on the quarantine hotels, and the long hours of wait time for reservation, segregation between the same family members, no food or very little or very bad. And also they literally say, because I managed to talk to some of them, they say jails are better off. I know this is federal, but feds are not listening nor acting, and they are left in the blue. What can you do to help these people?
Well, it's a very good question. I certainly have heard those same media reports. And in fact, I've heard from residents themselves who have taken it upon themselves to reach out to me, and we have spoken to them. Myself and my staff members have spoken to some of those folks who are in those quarantine hotels. I know that Ottawa is looking at a better way to deliver this program. I'll tell you that right now. I have a meeting with Minister of Transportation Omar Al-Gabr and Minister of Health Patty Hajdu tomorrow to discuss this very issue. on how we can improve these circumstances. Obviously, it was set up as a deterrent against personal travel, and it is doing so. It is doing that. People are traveling far less, and those that are wise and are familiar with the program are making their reservations in these quarantine hotels before they leave their destination and before they enter back to Canada, back home. Of course, this is just another layer of protection. While people are required to present a negative test before boarding an airplane, but of course they could be asymptomatic, and then they are swabbed again once at their arrival, and then they must wait 3 days for the result of that test before going home and finishing their quarantine. I know that they're looking to extend the number of hotels that are available for quarantine, and they're working very hard at that because I believe there is a capacity issue as well. But I know they're working very hard to improve the delivery of the program.
Follow-up question?
Thank you. The follow-up is just some remarks. I spent 3 hours today touring the city, and I've spoken to some of the residents. Of course, these small businesses are closed, but all of them are really frustrated, and all of them, most of them, and not all of them, said, if you look at Walmart, if you look at Costco, everybody is there, life is normal, and here we are, streets are full and packed, traffic is jammed at the traffic signals. You are doing nothing to help us, and business people, small business people are dying.
Yes, I certainly feel their pain and have raised these issues about the inequity and unfairness of those big box stores having that competitive and comparable advantage. It is wrong. I tried to move a motion to have the non-essential aisles closed in the large big box stores. I find it fundamentally unfair that they are allowed to open and that our small businesses have to remain closed. I think we've made that all very clear, but these are not our decisions. These are the decisions at the provincial table. They decide who is essential and who is not, and who will be open and when and who will not. So we're very hopeful that our small retailers will open with a limited capacity by Monday. And you know that we fought very hard to change, to right the table, level the playing field for our small businesses against those big box stores at both the Mississauga City Council and at Peel Region Council.
Thank you. There are no further questions today.
Thank you very much. Thank you for joining us.